Hi, Louise. Great to have you here.
Thank you so much for inviting me, and it's great to be here.
Great. So let's kick it off by hearing a bit about you and your own background within the payer and self-funded employer domain.
Great. So I'm a physician by training, internal medicine, occupational health, and preventive medicine. And I've always been fascinated by the connection between health and work. I've spent 30 years in healthcare, full disclosure. And I've been in clinical practice. I've worked in public health at the Centers for Disease Control and Prevention. I've worked in health plans, so for two major carriers in the US, United Healthcare and Elevance, which was Anthem when I worked there. And I've done almost every job that a medical director does in a health plan, from frontline utilization management to chief medical officer of a plan. I've also worked in a mid-level disease management startup. And now I've spent 12 years in consulting to employers on healthcare, specifically on population health management and strategies to improve healthcare outcomes, costs, keep insurance affordable, improve the employee experience and productivity.
Great. And so I guess that's where you find yourself working at Brown and Brown or B&B. So maybe you could tell me a bit about that company and how you interact with self-insured employers, carriers, and other entities and digital health solutions there.
So right now I'm the national clinical leader for Brown and Brown. I've been there 6 years. And Brown and Brown is the 7th largest broker consultant in the United States. We are also a global company. We have about 17,000 teammates. And we have several different practices, and one of them is the employee benefits practice. So I sit in the employee benefits practice, and I consult to large self-insured employers on a number of clinical and well-being topics. And really there are 5 or 6 that are on every employer's minds: cancer, musculoskeletal health, behavioral health, women's health and supporting families, metabolic health, also virtual care and gastrointestinal are 2 that employers are very interested in, as well as prevention. And I founded our Innovation Hub, which we'll talk about later, which has to do with digital health solutions. But I've also recently started a new practice for Brown and Brown that consults 2 solutions. It's called the Health Innovation Advisory. And it's firewalled off from our employer consulting. And the reason that we dipped our toe in this type of consulting is that we want to be able to shape the marketplace more and drive closer to the triple aim of affordable, efficient, highest quality healthcare. And we felt like consulting to solutions was a really good place for us to be able to pull together all of our knowledge and expertise on the employer side and push the marketplace.
Makes sense. And I'm excited to speak with you both, given that clinical and payer background that you've brought to benefits and innovation consulting. But first, at a high level, to remind the audience as well as ourselves, part of the intention of this interview is to create a companion resource to go with the self-insured employer validation cheat sheet. Ideally, you'll have that next to you as you watch this video, as it might make it easier to follow along, and it really helps accentuate some of the more nuanced topics there. And if you don't yet have it already, go to lionbird.com/SIE-sheet to download it. So let's dive right into it. To start, for those not familiar, even though we treat this employer space as one domain in healthcare to sell into, there are actually multiple distinct market segments here, each with their own unique buying patterns, influencers, and interests. So maybe you could briefly discuss, from the point of view of a digital health vendor or startup, what should they know about the importance of segmentation in this market?
Yeah, so that's a great question. Before I answer, I just want to say that I think that cheat sheet is excellent. It covers a lot of what entrepreneurs need to know. And so I would encourage everybody to read that really carefully. Let's talk about the market segmentation. So we look at it as 3 main segments: small, middle market, and then large and jumbo. Some people break out large and jumbo separately, but for the most part, small group size employers, which we define at Brown and Brown, other companies may define it differently, is generally less than 200 employees. That's usually a fully insured model. And that's really where they buy their entire benefit stack or package from a health insurance carrier, and they take on very limited or no risk. The employer does. It's the health plan taking on the risk. But over time, fully insured products can be more expensive. So we'll talk more about self-insured versus fully insured in a moment, but I just wanted to put that in because when we look at the other two segments, middle, large, and jumbo, we'll see that a lot of those employers are self-insured. So as employers become larger, they're more likely to self-insured because that means they're paying for the actual claim rather than the health plan taking on the risk. And what we're finding is most employers become self-insured at about 1,000 employees, but there's definitely some that are now moving to self-insurance above 500, and that's becoming more common. There's even a few below 500 eligible employees that are becoming self-insured. So, and I want to make a distinction between number of people on a health plan and employees. When we divide these market segments, it's eligible employees. The number on the health plan could be quite different because not every employee goes on the health plan. And then there may be a ratio with their spouses and dependents. There may be, 1.5 or 2 people on the health plan for every employee that does elect the health plan. So I want to make that distinction. So let's go back to the middle market for a moment. We define that at Brown & Brown as 200 to somewhere between 3,000 to 5,000. And so this is the group that starts to be self-insured. And then the large employers above 5,000 all the way up to the jumbos, which are generally, 100,000 or more, they are pretty much all self-insured. Why be self-insured? It really offers a lot of opportunities to control cost as well as to improve the health of the population. So when you're self-insured, employers can get access to their claims data and understand the population health needs, and they have more opportunity to customize their benefits and add ancillary programs.
And so as you speak about ancillary programs and putting all these different components in place, where do benefits brokers and consultants fit into this market? What role do they play?
Yeah, so that's really an important question. Our role as the benefits broker and particularly population health practice within the benefits setting is to decode what I call the parade of vendors. Employers and HR staff, they are getting knocks on their door like every minute with a new vendor. And it's really, really hard for them. They are busy. They do not have time to decode the parade of vendors. And so they really rely on their brokers and consultants to understand this space and to prioritize who they should talk to and what sort of figure out what fits into their ecosystem. So, they have goals and objectives, they have programs, they have gaps, undoubtedly, all employers do. And it's the consultant that really knows where those gaps are and what would apply and what would be worthwhile for employers to look at. So I think that relationship is really important, and entrepreneurs and new solutions need to understand that. And to be honest, consultants don't love when solutions go around them to go direct to employers, especially in the large and jumbo markets, because those relationships are very important to the consultants and they're very important to the employer too. So it behooves everyone to have strong relationships with the consultants so that they can really help direct them and help figure out where their best market opportunity is and help introduce them to the employer.
Sure, I'm guessing any employer does not want, as you say, a parade of vendors outside their door, without any kind of strategy or rhythm to, which ones may be a good fit to them. And this is a great kind of segue to the cheat sheet itself. Question one is really about teasing out some of the reasons that benefits managers may choose to purchase a solution or that a health insurance consultant may choose to promote and recommend you. And as you've led the Innovation Hub at Brown & Brown, in addition to being the national clinical leader, you have a great vantage point into this, and so I'd like to spend some time on it. So what exactly is this Innovation Hub? And in particular, because I think it would be relevant for digital health startups, I'm interested in understanding from beginning to end, as much detail as you can give, how your group goes about determining client needs and discovering, then selecting the right vendors for these self-insured employer clients.
So it's a great question. And, as you know, since about 2015, the number of startups selling directly to employers has greatly proliferated. And it's very, very hard to keep track of the many different solutions coming to market and how they differ from the others. So the Innovation Hub is Brown & Brown's way of keeping tabs of solutions in the marketplace that can assist our clients, our employers, with their healthcare challenges. And to date, we've got about 800 or so digital health startups in the hub. And really, our hub is a database. We use a platform called Benefit Pitch. And I think Benefit Pitch is an important thing for solutions to know about. It's a platform that a lot of consultants use in the US, and you can customize it. So we have our proprietary version for Brown & Brown. And we have a couple of different teams working at Brown & Brown to vet solutions. We have our large market team that looks at solutions that are selling to employers 5,000 and over. And our mid-market teams vet solutions that are selling to employers 200 to 5,000. And we really have a vigorous process for evaluating solutions that includes not just looking at the solution itself, but the funding, the current client base, the pricing models, ability to integrate with the health plan or other vendors. That's really key that the employer has in place. And then, of course, looking at the population they engage and the outcomes that they achieve. So when we work with employers, we start from the beginning. We take a strategic approach. And we apply proprietary analytics to their healthcare claims to really understand in detail what's going on with their population. So we want to understand the demographics, the geography, the prevalence of chronic conditions, what kinds of gaps they may have in care, what's going on with preventive care, what are the drivers of high-cost claims, what's the pharmacy utilization, and what are the employer's challenges? What are some of their priorities? For example, they may be looking to attract and retain talent. They may be looking to attract and retain certain types of talent, for example, women. So we take all that into consideration when we work with employers on their population health strategy. And then we look at all of that information and we seek to really understand also the company's culture, because that's really important. There may be solutions that just don't fit in terms of how that company operates. And so when we really do all this analysis, we figure out what the opportunities might be to bring in digital solutions. And one size doesn't fit all. For example, you may have a population that is all white collar sitting in offices. You may have a hybrid population. You may have a population that's out in the field mending telephone lines or internet lines, and they're going to be very different in terms of the ability to reach them and the types of solutions that they're going to be receptive to. So we have to understand all that before we figure out where the opportunities are.
Now, moving to the startup side, one thing that I've always found particularly tricky to explain to new founders entering this domain is the context of relative priorities. So when you're looking at what might stand out from a payer actuarial lens or from a population health focused angle, what might you do to pressure test whether a startup truly has potential to stand above the noise?
That's a really great question. And I think it's exactly why we started the Health Innovation Advisory. So we want to use our knowledge on the other side. Instead of the employer side, we're now helping solutions. So we're helping entrepreneurs differentiate and develop their solutions. And I alluded to this a little bit earlier as to how we evaluate solutions for our Innovation Hub, but I think there's a few key evaluation criteria, and you've got a lot of them in your cheat sheet. So one of the key things is there's so many solutions, and now we see funding has receded for digital health solutions compared to previous years. So we're really focused on, funding and staffing, the plausibility of a solution from a clinical point of view. Employers really want to know that they're not going to put in something that's going to go away in 6 months or a year, or that there's going to be financial problems with the solution. So, and they want to know that it makes sense from a clinical point of view or well-being point of view. I think what's key is what problem is the solution trying to solve for employers and for their employees and families. And I've seen solutions that are trying to solve a problem that the employer doesn't have, and that will never be a match. We also want to understand like how big a problem is this for the employer? If they don't have a lot of cost associated with the issue, if they don't have a big population associated with the issue you're trying to solve, then that's going to be a problem. How do you differentiate from others in the marketplace? I find a lot of solutions have trouble articulating what their differentiators are, and that's really, really important. And one of the differentiators needs to be, if possible, making the implementation easy, because these HR teams, some of them are very overwhelmed. They don't have a lot of staff in general. And so it's really hard for them. It's hard for them to evaluate solutions. It's hard for them to figure out which ones make sense and will fit in their ecosystem. And it's hard to put a lot of work on them. And so the more that a solution is easy to implement, the more that a solution helps the employer engage the population and fits into that ecosystem, better off that solution is going to be. It also has to be easy to use for the end user. And that's really important too. Like, what does the digital interface look like? And is it hard for people? That will be sort of a non-starter. And then the data is also an important thing. Like, what data will be required to implement the solution? And how difficult is it for the employer to get that data? And then when we look at data, we also want to be sure that the company is passing the data privacy requirements. And some of these employers have really stringent requirements and a lot of testing. You have to go up to a lot of levels. So that can take a lot of time. Even if an employer decides to implement a solution, all of the data privacy issues, working all that out may take time. And then they're going to want to know what data the solution has. And even if it's a new solution, something, engagement data, clinical outcomes if you have it, user satisfaction, ROI, VOI, these are all the types of things that employers are going to want to measure. And clinical plausibility, as I said, is very critical, especially if you don't have a lot of data.
I think this is all great. And I think at some point, we're going to need to do a follow-on video, as many of these topics deserve further discussion. But in the meantime, for those who are just getting started and getting early input and guidance from the market, having this input from the other side on these points sounds like a really smart way for newcomers to the space to get started on the right foot. And, shifting gears, before you were in consulting, you spent some time in the payer side, overseeing programs including utilization management, case management, network management, all very relevant as cost containment now is showing up consistently right next to mental health as a top priority for self-funded employers. Can you share from your vantage point why, despite the existence of many, a parade of vendors that claim positive ROI, insurance costs just keep rising year on year, and they're even accelerating despite every vendor claiming, incredible results. So where is this coming from?
Yeah, so there are a lot of things that contribute to increasing medical spend, and many of them are outside of the employer's control. For example, general inflation, mergers and acquisitions within the healthcare ecosystem, very common. They may increase costs. Physician and other healthcare worker shortages, pay increases, new technology. There might not be a lot that an employer can do on some of these issues, but there are other issues driving healthcare costs that employers can try to help contain. For example, the cost and use of specialty drugs. So look at GLP-1s right now, really driving up a lot of costs for employers. Variations in cost and quality. The best care will be the most efficient and lowest cost care. Ultimately, that's what the triple aim is about. And so employers can drive toward decreasing these variations. An aging population, more chronic conditions. And this is something that employers definitely put solutions in place. And then there are inefficiencies and redundancies in the healthcare system that employers can influence and can push on health plans and providers to decrease. So it's a mixed bag.
And, part of what we've seen in response to these rising costs is that the number of employers going the self-funded route is increasing, partly because it offers more flexibility in benefit and network design, which we'll talk about. But for those who may not be as familiar with what this move from fully funded to self-funded entails. Could you provide a brief overview on some of the key decisions that companies usually are making as they are making this move, as well as the role consultants take in helping plans with that process?
Absolutely. So what employers need to understand as they move into self-insurance is sort of the volume and nature of employee healthcare claims for the past really 5 years. They need to analyze their cash flow. They need to evaluate whether they want to have other coverages. So a lot of times when employers become self-insured, they'll have something called stop loss coverage, which will cover any claims over a certain amount, like let's say 500,000 or $1 million, depending on whatever attachment point they decide on. And there's a cost to that and a premium to stop loss coverage. So that's something they need to look at. They need to decide how are they going to administer the plan, because they can put together different pieces and parts once they're self-insured. So they can have what we call a TPA, a third-party administrator, which could be a carrier, so not a health plan, but a carrier, or it could be a different entity, independent third-party administrator, not owned by a health plan. They could also put together a different pharmacy benefit manager. They can put different solutions. They can change their plan design. So they have a lot of decisions to make when they go self-funded, but a lot of these decisions can ultimately control costs in a much more efficient way than if you're fully insured.
And that's helpful context on what these clients are going through on the back end and have usually already set up in the background, usually prior to even starting to consider this parade of vendors. And after an employer has gone the self-funded route, they typically, as you said, have more latitude to pursue different strategies within cost containment and with other priorities. And so what are some of the main levers by which they tend to curb these rising health costs? And are there any current trends in cost containment that you're especially excited about in terms of being underutilized and able to make an outsized impact?
So there are a few main levers for cost containment. One is plan design. So in plan design, employers can cost shift to employees through high deductible health plans. And those have been used for several years now in the US. And it's really about giving employees and their families kind of more skin in the game, if you will. And so if the deductible is higher, it kind of encourages people to utilize resources in a more efficient way. But when you have a high deductible health plan, you have to provide a lot of education because people don't often understand the choices. For example, an MRI might be a lot cheaper if you do it at an independent MRI facility than if you do it at a hospital. But consumers have to be educated on that. Otherwise, they'll end up going to the hospital and spending a lot of money. And that's the whole idea of the high deductible health plan, is for them to choose the lower cost setting, because a lot of it's coming out of their pocket initially with the deductible. It hasn't necessarily worked out that way. And we see now kind of a reversion in the cost shifting, where employers feel like they can't really cost shift anymore. A lot of employers are kind of saying, okay, let's lower some of these deductibles. And generally high deductible health plans cover preventive services at 100%. But a lot of people don't understand that because they don't have the benefit or health literacy. And so you see people skipping preventive services under high deductible health plans or not utilizing the services that they need. Also, in terms of plan design, you can look at utilization management programs, particularly on the pharmacy side. That's becoming really important with a lot of high-cost drugs coming down the pike, gene therapy, GLP-1s. So utilization management programs, step therapy programs, these will become more important than ever on that PBM side. And then incentives. So we see employers using incentives to change behavior, to go to lower cost providers, for example, or to have lower cost treatments. So we can talk more about that later when we talk about network design. But network design is definitely one big lever to control cost and quality. We'll get there in a few minutes. What else what are the other levers? Clinical solutions. And this is where our digital health comes in. Solutions to decrease risk and manage the high cost conditions that I mentioned before. Everyone's interested in cancer, musculoskeletal, behavioral health, metabolic syndrome, women and families, and pharmacy. And also we're seeing a rise now in employers being interested in GI conditions, a lot of spend there, autoimmune conditions, and drugs that go along with them. Well-being, keeping the healthy, promoting prevention and PCP relationships, very big. I think a lot of employers are getting more convinced than ever that PCP relationships will help to decrease healthcare costs and help to navigate people through the healthcare system. So big emphasis on that and on early detection of a disease, because through the pandemic, people were skipping screenings, more late diagnosis of cancer, more cost of plans, and also the intangibles. When you keep people healthy, when you decrease their risk, the softer costs of healthcare, disability, absence, and presenteeism, where people aren't as productive as they can be, all of those things can be decreased if you're able to detect disease earlier and treat it earlier. And then the last part is really navigation and advocacy, being able to get people to understand how to get around the healthcare system, what kinds of services they need, what's covered by their plan, how they can maximize their benefits. So it's benefits navigation and also clinical navigation, getting people to the providers that they need to go to, making sure that their diagnosis is right, that their treatment is right. You know, this is where second medical opinion services come in. And health literacy is a really important part of that. So in terms of trend and the ability to really make an impact, some of the solutions that I think are categories of solutions that I'm pretty excited about are specialty pharmacy management. There are new types of PBMs. There are coupon programs, you know, controls, other things within the specialty pharmacy management area, I think are going to be really important. I'm interested in financial well-being solutions. I think a lot of employers are there today. I'm not sure they're convinced of the ROI yet on some of these, but there's a lot of sort of mental health issues related to financial well-being solutions. People get very distracted by their finances, and it can really decrease productivity and presenteeism. And so those are some solutions that I feel like are really important for employers. Global solutions also. Employers have realized through the pandemic that they can't just work in silos anymore. Very often domestic and global have, in terms of benefits, have been very split in employers, and safety has been split as well. And now they're realizing all these pieces need to come together in order to make a globally productive workforce. So, and they're looking for solutions globally in well-being and clinical areas. So those are some of the things that I'm kind of excited about.
That's a great overview, and a lot of ideas come to mind for I think opportunities for startups to plug into. And once you understand how varied this ecosystem is and what these employers usually already have in place, you can start to understand the desire for simplification of that ecosystem and to maximize what they've already contracted with by baking what you have in place into the health plan and network design. And moving on to one of the more effective and important means of cost containment is via network design. Could you give a brief summary of what decisions and what trade-offs are involved here for self-insured employers?
Absolutely. And I think this is one of the areas that employers have a very big interest in right now. And so there are a lot of options, and they really run the gamut from custom tiered networks with carriers to outside high performance networks and PCP focused solutions, digitally enabled practices, and then all types of virtual health networks. So it could be virtual health hybrid combined with a retail setting, combined with on-site clinics, combined with some type of either custom or carrier network, and then on-site networks themselves. So there are a lot of different options in this area. And then there are also navigators, especially for behavioral health. This is becoming very popular with employers, actually. And then things like centers of excellence. And so the decisions for these types of networks are based on a lot on access, when employers are really trying to solve the access issue and the quality issue. So they're based on access, geography, industry, types of jobs, populations, other solutions in the ecosystem, cost drivers. And I'll give you an example for centers of excellence. Employers in the US have sort of three options. One is a carrier solution. So carriers have centers of excellence. Most of the major ones do. And they're usually in several different clinical areas. There's 5, 6, 7 clinical areas like bariatrics, musculoskeletal, infertility, et cetera. And so the carriers are one solution. There are independent networks that have come up, solutions, digital and otherwise, for centers of excellence. And then employers can do direct contracting with different facilities. For example, for cancer, they can go to the major cancer centers around the country. But there are a lot of questions about how do you design that benefit for different types of networks? How do you incentivize people to use or go to the care that the employer is setting up as best access and best quality? So it's very involved, and usually employers will rely on their benefits consultant to help choose and design some of these network options.
Sounds like we've gone beyond the sometimes limited provider networks that you get from your carriers. And it totally makes sense that any employer that is not steeped in this world would need guidance on design.
Absolutely. That's an exciting space.
Moving on to billing, it's really critical for vendors to understand how the money flows in this domain, which of course starts with awareness of what budgets are even available to tap into. And this is important enough that we dedicated an entire section of the cheat sheet to it. So maybe we can start by trying to understand the difference between billing via the medical versus the administration budget, or in other terms, you can call it working with clients as a vendor versus as a covered healthcare provider. Why do clients even care how they're billed, and what should vendors be aware of in terms of the size, stability, and timeline differences between these budgets?
Right. So when a vendor comes in through the administrative budget, so the HR budget, it can be a lot more difficult to get buy-in. So HR budgets are getting a lot tighter. And there's a drive right now to streamline solutions that employers have to scrutinize both the value on investment, the return on investment, identify duplication, and cut whatever is not necessary. They also want to simplify the member experience. So these budgets are much smaller than the expected claims budget for self-insured employers. So in most cases, employers vastly prefer to pay for vendor services through claims as a covered provider rather than getting invoices under a master services contract with the employer. But there's more to it than that. Employers are also looking for performance guarantees, and they might be financial, health outcomes, have anything related to the solution that has to do with safety, quality, whatever applies to that solution. For example, for behavioral health, they're looking to improve rating scales. So the GAD-7 is a anxiety rating scale, and PHQ is a depression rating scale. They may be looking for some kind of performance guarantees for those. So, for solutions aimed at improving continuity of care and navigation, they might be looking at decreases in hospitalizations or readmissions. So it's about getting paid through claims, but also having some performance guarantees. And engagement is a huge piece also. Employers are definitely looking for guarantees on engagement.
And so knowing all that, how can a vendor go about positioning themselves to be included in medical spend versus administrative?
Yeah, so that requires working with the third-party administrators, both those that are owned by health plans and independent TPAs, to really become a contracted provider, making sure there's a CPT code that will correspond to your solution or services. And as I mentioned before, in terms of engagement, employers like billing through claims because they'll likely be engagement-based billing. So they'll only get billed for members that use the solution, not the whole population. And it really implies that a vendor or solution is willing to go at risk for engagement and that they have confidence in their solution and skin in the game to promote engagement. And one of the biggest issues with digital health is getting people to use the solution. I've seen many cases of employers spending a lot of money and not getting engagement. So billing through claims can also involve bundled payments or billing for outcomes, not just services. For example, a metabolic syndrome vendor or weight loss vendor may bill only for the months a person is engaged in the program, and that engagement needs to be defined, obviously. and they may bill only in proportion to the amount of weight lost. So those are the kinds of specific types of billing that employers really like, because A, it's based only on those that are using the solution, and B, it's based on outcomes. And a physical therapy solution could be billed, by the session, and for the outcomes could be things like decreased pain or increases in ability to function. But employers like very specific type of billing. They don't like billing based on the whole population, which again, usually, relates to budgets.
And that's a great tie-in to an additional common barrier to adoption, which is low utilization, also addressed in the cheat sheet, and of course is related to how you bill. Because if it's per member per month, was common kind of in the early days of digital health, but the self-insured employers are starting to demand more for their budgets. And related to this subject of budgets, there's workers' compensation, there's also short-term and long-term disability, also covered by employers. But you hear about them less often as a target for digital health startups. What should vendors know about their potential eligibility for positioning themselves to tap into these budgets?
Yeah, so that's a great point. And from a sort of broker consultant point of view, workers' comp crosses over from employee benefits to property and casualty risk. And disability is often managed by a different set of individuals than health. So to tap into these budgets, it's necessary to bridge different silos within an employer's benefit group. So it's safety, it's property and casualty, it's employee benefits. But, part of the ROI or VOI business case for a solution could be to bring in these softer benefits, as I talked about before, of decreasing disability, absence, presenteeism. But it's much more complex to bridge these silos. And you may even have to go up a level to CFO that tends to be responsible for all the different silos, or to rely on your broker consultant because they may have connections in all those different silos. For example, Brown & Brown, we have a property and casualty division, we have an employee benefits division. We're always trying to figure out how those divisions can work together. And so if a solution applies to workers' comp and or disability, that's where we can perhaps bring in some of our property casualty and workers' comp people to help bridge those gaps.
Well, I think we covered a lot of ground today. And to wrap things up on a high note, we'd love your take on why should founders and investors in the digital health arena paying close attention to self-insured employers as a budget holder for innovation in healthcare?
Great question. There are many ways that solutions could go. They could obviously go B2C, to consumers, but I think self-insured employers present a big opportunity because they're really looking for solutions actively to decrease costs, keep insurance affordable, maintain their bottom line in terms of profits, and be able to sustain their business. So healthcare costs really relate to employers' financial performance, and they're becoming a bigger and bigger part of their spend. So particularly in the large and jumbo market, some self-insured employers have been the tip of the iceberg in terms of innovation. But that appetite for innovation varies widely among employers. And it's important to understand your particular audience and prospects. Who are they? What are they trying to achieve? What is their stance on innovation? Are they leaders, fast followers? Are they last in line? What problems are they trying to solve? And, again, what are the characteristics of their workforce and their resources? And this is where the brokers, consultants can really help in terms of guiding entrepreneurs and solutions. The other piece are channel partners, health plans, navigators, and other solutions. And I think that's a very viable way for solutions to go. All of those entities are aiming at the self-insured market also, but those partnerships can benefit digital health solutions. Also, now I've seen partnerships with life insurers, partnerships with disability groups, and stop loss. These are all channels, if you will, into the self-insured market. So again, we've launched our health innovation advisory to assist in positioning solutions, building roadmaps, building business cases, helping with ROI and VOI, among other services for solutions that are aimed at the self-insured market.
So despite there being a parade of vendors and a very complex ecosystem to navigate, for those looking to really make an impact on healthcare, it sounds like a great market to sell into, and it's great that people such as yourself are supporting them. And so how can viewers of this video who are kind of curious about learning more about your practice and how you can help, how can they best go about getting in contact with you?
Yeah, so you can email me at Louise, Louise .short, SHORT, at bbrown.com. And we're excited about launching our Health Innovation Advisory, and we would love to assist founders and entrepreneurs. And thank you again so much, Jonathan, for having me here today, and really appreciate the discussion.
Thank you. Looking forward to continuing it.